future, healthcare will probably look a little bit like this. We should go to a hybrid form of care. Patients collect data at home, probably much more than they do now, but also other important data in hospital, and they're integrated and collected in large international databases. We need AI algorithms to really create an individual patient profile and predict response to treatments, progression, and being able to offer them personalized treatments. Often the patients are not the problem, they really want it, but healthcare providers are. So we have dedicated nurses also who really like this and will see that it's in the end leading to sometimes less work instead of more, because they already have contact with the patient before there's a really big problem. But that's also one of the reasons that we do the big implementation study. Starting with just qualitative interviews with all different stakeholders. What are your expected struggles, barriers, and what are solutions? And to really come towards a care path where everyone is involved.
I think we first have to really think seriously about, before we start, from the medical incidents, but also from the from the feasibility of having solutions. I think we need to follow the willingness of the system to pay for it, right? So often we ask ourselves the question, if we have a good solution, who's now paying for it? And then we are, but we have to answer this first. And we have to convince the right stakeholders from the early beginning that they at least want to, what they need to make it happen. So that's why we are going to OKP, and we start with, based on our German information, we made from the early, we make clear this is something we can prove in Switzerland. If we can prove this, would you be willing to pay for it? And if you get the answer yes, but we need this and this and this data, and maybe also Swiss relevant data for Switzerland, Dutch relevant data for Holland, so for the Netherlands, sorry. I think this should be the starting point.
We know that it's not easy to put those reimbursements in place, because there are many diseases, many devices, many stakeholders included. But at least we have to start somewhere, and that's why also we work with the people like with the Hirslanden Clinic, who are investing in this pathway and discussing with the insurance company in Switzerland, also with the local governments, who are more and more willing then to try things and to gather data to see how we can find new ways of reimbursement.
I think it all starts with showing the medical benefit of a digital health intervention, and then if you also do a good job marketing, you will engage stakeholders, the relevant stakeholders, and also achieve reimbursement. I think key to success is really showing medical benefit on physician side, but also on patient side, right? If they don't feel that they benefit from using the app, then they will discontinue it at one stage. So I think that's the main part. And on the other hand, also time is ripe, and I think the outer circumstances. I mean, you have increasing healthcare costs, limiting capacities for healthcare professionals, and so on and so forth. So I think this is all a bit fueling this digital health space, and there is a massive opportunity behind.
For me, it's also a question of the healthcare professionals. They also have to be convinced, and they have to be in this easy process. If it is just an add-on to their daily business, now I have to check my alerts and whatever, it will also not flow. So it's also we also have to break up our actual system, and we have to have these digital processes also that they will not come by themselves. So that's also something where we have to work on.
But I think it's so obvious and evident, the ease of use for the patients, the value that we create for the system. So the vision is clear. I think there are still a lot of obstacles on the way, but we're all here also to advocate on that, and also to collect more evidence and more convincing examples as we've heard today.